Welcome to Breathe California TV. Each week we present a discussion on how to improve your lung health. Most of medicine is oriented towards coping with problems that develop, but my focus on the show is largely the focus on prevention. So today we're going to be talking about smoking and how to prevent it, because it's about the worst thing you can do to your body. So we'll be talking about that in 30 seconds. See you then.
The different therapeutic methods that we can help our very low socioeconomic status clients who have no alternatives, no anything, and there's still about 15 different resources we got out of this that if you have no resources, no service connection, you can still get aid.
That they are connected, one encourages the other, and that the process of change from backing off from the tobacco is the same as backing off from any other addictive drug.
Everyone can benefit from this training that we just were offered today. I would not take it back.
Welcome back to Breathe California TV. My guest is Tanya Payyappilly from Breathe California. Welcome.
Thank you, Terry. Hi,
So
everyone.
what do you do for Breathe California?
I am the project director for our California Tobacco Control Program grant at Breathe California.
So what's California wants you to do under that grant?
So first of all, at Breathe, we work together with the community to promote lung health in all forms. Based on that, we have a grant from the state of California to work on various objectives. And there are 4 objectives that we currently work on. One of them is to promote smoke-free outdoor dining areas in the Bay Area. We work all together in 8 counties. And the other objective is to work to promote evidence-based policies for smoking cessation in mental and behavioral health facilities. Thirdly, we work on promoting flavor bans in the cities, tobacco flavored bans, and lastly, smoke-free campuses in the Bay Area. So these are our 4 objectives that we're currently working on, and we will be doing this over the next 5 years.
So one of those was particular interest to me. Do you work to have assisted living facilities be non-smoking?
So yes, so we would definitely support that, but right now we are giving more infrastructure and policy advice to behavioral health and assisted living areas if they don't have one already. So how can they adopt one? What are the programs they can implement in their facility? We train their trainers so that they are well equipped to hold such cessation programs in their facility.
So my wife is assisted living for the last 2.5 years, and I'm pleased to say that I've never seen a cigarette in the place. They have a couple of no smoking signs for the workers there, but residents aren't allowed to smoke, which I think is great.
That's great, yeah.
I want to praise you. This ad, which nobody can read, is full-page ad that Breathe California ran yesterday in the Mercury News, and it's entitled "Protecting Kids from Smoking."
Yes.
Is that a good way of describing what you're doing?
Yeah, all of us have the duty to protect our kids, and yes, Breathe California, is also working on that. And right now, more than smoking, we see our students and kids vape. So we're mainly concentrating on, researching and advocating for policies around cities to ban the flavors of tobacco, which is actually targeting our youth population.
So just to give us a good starting point, what do vaping and e-cigarettes mean?
First of all, vaping and e-cigarettes are one and the same. So the tobacco industry always has tactics, marketing tactics, and so vapes. The term vape is meaning that there is water vapor in that device, but it's not true. When you think of water vapor, it's just simple water and heating up, just like how you heat up a kettle and the water vapor comes out of it, right? But when you heat up a liquid in a cartridge with flavored substances in this, it's not just water vapor that comes out of it. It's a concoction of chemicals. And these chemicals together is called aerosol, which is very similar to what comes out of a hairspray bottle. So so there's a difference, and electronic devices and vapes are mainly the same, but it's just different terms that are being used.
Are they trying to simulate or be the same as tobacco smoke with what they're producing?
Yes. So it contains the same chemical called nicotine. Well, there would be some things that are excluded from a vape, would be like the tar that comes out of a cigarette, right? And the smoke, the tar, that is different. But there are a whole variety of other chemicals, and along with the flavors, I should say, along with the flavors that goes into this cartridge.
So what's the substance in vaping or e-cigarettes that gets children addicted to it?
Nicotine. So it's nicotine,
So,
it's a drug, it's a stimulant, and it has these, pathological effects. It increases your heart rate, your blood pressure. It has addictive properties because it acts on the brain to release the feel-good hormone called dopamine, which is actually supposed to be released naturally by your body. But in people who use nicotine products like tobacco, or either it could be a cigarette or a vaping device, both of them contain nicotine. And once nicotine reaches your brain is tricked to release dopamine. So as you get addicted, you depend on nicotine because your body, there's there's a mix up that the body's natural ability to produce dopamine is intervened because of the tobacco. So you want more and more nicotine so that you feel good. So it has a really a cycle of addiction, I would say.
so tell us about what secondhand smoke is and why it's considered to be bad.
Secondhand smoke is a whole huge topic that I can talk about. And, we could have like another show just based on secondhand smoke, but I will tell briefly. So if I light up a cigarette, and if someone near me stands or is sitting, or if I have a baby who's in the same household, that smoke is going to linger and move away from where I am onto the surroundings. And if there are people in that surroundings, they are able to inhale that smoke, and it has a lot of chemicals, just like what is in a cigarette smoke that the person is inhaling. So, secondhand smoke is harmful in its way, just like you're smoking a normal cigarette. And to add to it, there's the secondhand aerosol, which comes out of a vaping device or an electronic device. It has similar effects. And what we are learning is, there needs to be more research on what the secondhand aerosol can cause, just like how a secondhand smoke can cause in an individual.
Well, Breathe California has been very good about working with government agencies to control secondhand smoke. And when we started doing that, I have to tell you, I was astounded at how far away secondhand smoke can have bad effects on growing lungs. So you already anticipated my question when I was going to ask you about vaping and e-cigarettes and their similarities to secondhand smoke.
Absolutely, because that is something that we also encounter when we do our education sessions. People think that it's just vapor coming out and it's okay if you're, vaping beside someone or in the household, but that's not true. And there's more than secondhand smoke. There's third-hand smoke that that actually sits onto the surfaces, and it stays there for many, many years. So there's the third-hand smoke also that contributes to harmful health effects.
So 40 years ago, my parents bought a vacation house for themselves on a beautiful lake in Oregon.
Mm-hmm.
And my dad and my brother and I went up to renovate the house.
Mm-hmm.
And we were absolutely astounded that heavy smokers had converted white wallpaper into about the same color as that dresser behind you. Amazingly dark brown. When we take a picture off the wall and we'd find the original white. So it was pretty scary what secondhand smoke does, and arguably its persistence.
Yeah, I agree. I have the same issue in my house that we bought in San Jose. So I hear you.
So we're about halfway through. Tanya and I are going to be back in 30 seconds to talk more about the health effects and the implications of vaping and e-cigarettes. See you in 30 seconds.
What it feels like to have an asthma attack is, well, you can't breathe and you can't tell anybody that you're having an asthma attack because you can hardly talk. You can maybe say 1 or 2 words, but you can't say much else. Breathe California has helped me come in contact with more asthmatics and more people who have the same case as I do. It's important to me because I don't feel like I'm alone in the fight against asthma.
So Tanya, before we dive into what I promised before the break, tell us a little bit about Breathe California. Who are they and what do they do?
So Breathe California, we are a local nonprofit organization. We are based in San Jose since 1911, and our main mission is to fight lung disease in all forms. We started off with fighting tuberculosis in that time, and once we conquered tuberculosis, we've moved on to working in different areas that promote lung health. And we do this together by educating, researching, advocating, working with the community mainly to protect lung health of our residents.
So let's go back to vaping and e-cigarettes. Where do kids get these products? It's legal for them to be buying those?
So there's the tobacco 21 age where you have to be legally 21 to purchase any tobacco devices, vapes, or products. So if you are under that age, technically you're not supposed to have that in your hand. But kids get these mainly if someone in their household uses these devices or products, they can easily get hold of them. The other places they get it is retail stores. So, there are times, many retailers do check the identities for the driver's license, just check their age. But there are places that, maybe don't check it. So retailers, they get it from the retailers. It could be like at a store, a grocery store, or like a normal gas station or anywhere like that. And the other place they get nowadays is through Amazon lockers, but there's a good regulation on that. that people have to, someone over 21 or their parents have to sign when somebody delivers the tobacco product at their doorstep. So it's not like kids can just get it when their parents are at work. So that has been regulated very recently. So that's good news. So mainly it's available outside, like in the retail stores.
Yeah, the retail stores are what worries me. They obviously are interested in selling product. 10 to 15 years ago, we had a investigation with the city of San Jose, and the mayor, Margot, our executive director, and I held press conference because they did find stores that were more than happy to sell cigarettes to underage kids. But remarkably, retailers in San Jose seem to be pretty good about it, even though we found some bad apples.
Yeah.
So what's the technique that's used to get more interest in underage kids to smoke? One of the things you wanted to talk about was flavoring.
Yes. So now that's an essential issue for youth, right? Because flavors are colorful, they're attractive, and they taste good. That is one thing, and it masks the harshness of tobacco just by itself. So the flavors basically mask the harshness of tobacco, which makes it easy for the product to go down your system. So kids think it's okay to do it. Secondly, it's the creation and evolution of the vape batteries, which comes in so many different shapes, sizes. So you might see things like Hello Kitty pens, which are actually vaping devices. So that those are geared for girls. They have superheroes from movies geared towards boys. And so all these different shapes, sizes, and the materials that they use are very enticing for youth. And there's evidence that strongly suggests that if individuals do not start smoking before the age of 19, they will never start. So the industry knows this. And it has also been researched that smoking kills 50% of people who have been addicted. So to replace their, the percentage that dies from smoking, they need new recruits. So they have techniques of introducing newer, enticing, colorful things every generation. And right now it's the flavored tobacco that's, in the market.
A few years ago, before the epidemic, we did a show on how tobacco was trying to interest underage kids in smoking by their advertising campaign. Do you still see that as a problem?
Yes, so we used to see that, but that's being regulated now, so which is a good thing. But one thing was, like, the FDA was supposed to regulate it maybe by 2016 or before that. In 2009, President Obama had signed something that FDA regulate this, but it took a very long time for FDA to do anything. So, but we still see that our local cities are doing their best to protect their kids. So we don't see as much right now.
So obviously the big lung disease problem we have is COVID-19 the last year and a half. Does smoking make you more susceptible, or what kind of impacts are there?
Yes, it does increase your susceptibility. So if you smoke or vape, your immunity, you have a decreased immune system, and the risk of getting infections increase as your immune system decreases or is not strong enough. And moreover, when you vape or smoke, you use the action of the fingertip from your fingertips goes towards your mouth and your nose. So you're getting more germs in, and your risk of infection increases, and that's true for COVID-19 also.
So pretty interesting. Anything, it seems to me that anything that weakens your system's ability to
Mhm.
fight off disease makes you more susceptible to COVID-19 and any of the other 10 or 11 forms of lung disease that you work with.
Mhm.
My wife's assisted living facility, I'm not sure there's anybody in the place under 60, and 24 out of the 94 residents died of COVID during this past year. And they're just much more susceptible because of the health implications, which is
Yeah, that's really
healthy,
sad to hear that.
healthy people in their 20s or 30 aren't nearly as much at risk of at least dying from COVID.
There are mixed studies about that. So, while your immune system decreases as you age, there have been cases that if you do smoke or use, tobacco products, your immunity decreases even if you're like 20 or 30, and your susceptibility to COVID or any infection actually increases because of that. Even common.
Yeah, I would think any use of cigarettes or smoking is going to lower your resistance, whether you're 11 years old or 99.
Right.
It has that impact on everybody, so that
Mhm.
any other disease has a better chance of getting a hold on you and with that happening.
Mhm.
So is somebody arguing that vaping reduces smoking use?
Vaping device came into the market. It was somebody, a pharmacist in China, who thought that people were dying from lung disease or lung cancer, and he wanted to help them. So he came up with a device that does not produce tar, and it was an electronic nicotine delivery system. It was called at that time, and I believe this was in 2002 or 2003, and that seemed to have helped that people who were dying from tar-related diseases and lung cancer. But then the market shifted, and then it came to all the different countries around the world, and it's been adapted to newer devices, sleek-looking devices called vapes, and there was Juul. Now there is Swarin, and different types of devices with different concentrations of nicotine that is available now.
So regular cigarettes have tar in them,
Mm-hmm.
and it's a health danger just like nicotine.
Yes, it is. Because it's a lot of chemicals, and then there's carbon dioxide. The things are burning, and that produces chemical soot, and it's going into your lungs. So it produces tar. It's like a black liquid in your lungs.
Yeah, I mean, the goal of the lungs is to be able to breathe in air and put it into your blood system. And tar, it seems to me, would block the pores in your lungs.
Yeah, it will block the pores. It will also reduce the elasticity of the lungs. That, the function of the lungs, like you said, is supposed to take in the oxygen and leave out the carbon dioxide. But instead, it gets trapped inside. The carbon dioxide gets trapped inside, and it can cause conditions like emphysema. So you have like a bloated lung because of that.
So we've got about 3 minutes left. You got something that I should have asked you, or you think we ought to cover?
I do want to say that if someone is addicted to nicotine or smoking or vaping, there are various resources. There are many programs available that can help a person stop smoking. So we offer various resources. At Breathe California, we have programs that are geared for adults as well as children. So we also have educational sessions that we hold at schools. So if anybody would be interested, they can reach out to us or look at our website. For a start, we have all our services listed, and this is not just about tobacco. It is about all kinds of lung problems, and we promote lung health. So there we have a variety of resources available on our website. So please go to our website and check us out at www.lungsrus.org. And yeah, so that was my last 2 cents I wanted to add.
Yeah, if you've got any questions from our discussion, go to Breathe California's website, which is under Tanya's name when we flashed it, or just give them a call at 408-998-5865. I've been a volunteer since 1973, and some years we've helped as many as 150,000 people, but with the epidemic, I understand it's only been about 40,000 this year. So we've got 1 minute left. What's your big grand wrap up? What do you want everybody to remember about you and I talking?
I want everyone to remember that we need to work together working together is so important, and we need to work in numbers so that we are able to be better community advocates and have better policies in our cities in the Bay Area. So working together, we're able to share and disperse more information, especially when it comes to flavored tobacco and vaping devices among our youth and their parents. So work together, get the information out, let people know what this, vaping is or flavored tobacco is and why it's targeting the youth. Yes.
So next week, we'll discuss another lung health program, ways to protect your health and help you live longer. Hope to see you then. Good night.